I'm Dr. Hema N, working as Assistant Professor in Department of Speech Language Sciences, All India Institute of Speech and Hearing, Mysuru. Have you ever had a word right on the tip of your tongue but just could not say it? Now imagine feeling that way all the time, struggling to speak, to understand others, to read or to write. This is the daily reality for persons with aphasia, most often caused by stroke or head injury. In the earlier module, you have learned what is aphasia, what causes it, and how different areas of brain control our speaking ability. In this module, we focus on treatment and support for persons with aphasia. But every aphasia patient is different, so the treatment depends on the type and severity of the problem. Let me tell you about Ravi, who is 45-year-old male, one of my patient. A few months ago, Ravi had a stroke. Afterwards, he struggled to speak. The words were there in his mind, but they just would not come out. As a speech language pathologist, I explained to him and his family what was happening. You see, our brain has different areas for different language skills. One area is responsible for speaking, another area is responsible for understanding other speech, and there is other special area which is responsible for reading as well as writing. In Ravi's case, the stroke had affected the area of the brain that controls speech. That's why he could not speak well. But here is the good news. The rest of his language abilities were still working. He could still understand what others said. He could read simple sentences. And with some practice, he started using gestures and even writing to express himself. As speech therapists, we help patients like Ravi use these other ways to talk, while we also work on helping them speak again. We try to stimulate their brain areas responsible for communication. Slowly, with time and practice, Ravi started to get better. One of the first steps is training people in new ways to share their thoughts and feelings, as using hand signs, pictures, writing or drawing, especially when speaking is very hard. We also train family members to communicate effectively with aphasia patient by teaching them how to communicate more efficiently. That is, by the use of simple words and short sentences, give the patient extra time to respond, ask yes-no questions if they are easier, avoid correcting too much, focus on what they are trying to say, and also to support aphasia patient to communicate without any pressure. Be patient and encouraging to aphasia patient when they are communicating. Use gestures, drawing or written words if needed. Focus on successful communication, not the perfect grammar. And also we recommend to use tools at home like the communication board, picture cards or mobile apps. And also we recommend to practice speech exercises given by the speech language pathologist. Understanding aphasia is better by learning that the people with aphasia still have their thoughts and intelligence at the better end. They just need new ways to express them. There are also more special ways in which we train patients to practice talking again. The first one is, the first method encourages them to speak without using hand signs or gesture. Another uses singing or rhythm to help them say words. Some methods help them remember words by talking about what the word's meaning is and their association with other things. Another speech therapy method helps people with aphasia to learn to form sentences more correctly and easily by repeating them, filling in missing words, reordering jumbled words, and answering questions using full sentences in a conversation task, story narration task, or picture description task. In some cases, doctors might also use special machine or medicine and give electrical stimulation to the brain area, but only with expert guidance. All of this falls under the broader treatment. We call it as speech language therapy. It can include individual session, group therapy, and even at home practice using computer apps which help patient work on their skill anytime and anywhere. Now you might ask, will someone with aphasia get better? The answer is, it depends. Some people recover completely, others may always have some difficulties. But with early speech language therapy, consistent practice and strong family support, many people improve a lot, sometime over months and sometime over years. The most progress often happens in the first 6 months after a stroke, but recovery does not stop there. Hence, it is very important to consult a speech language pathologist in the early days after the stroke. Every journey is different. Some people regain most of their lost functions, but others learn new ways to connect, as mentioned before, with gestures, writing, or even drawing, and go on to live full, meaningful lives. A patient like Ravi who availed speech language therapy can also be recommended to Department of Clinical Services, All India Institute of Speech and Hearing, Mysuru. Thank you.